Hi there, this is Dr. Kashyap, and I'll be talking about facelift procedures today. Some of the common questions that have been asked of me. The first question that is commonly asked is who is a good candidate for a facelift procedure? For a surgical facelift procedure, we usually think of people who are in the fifth, sixth, or seventh decade of their lives, who have laxity of skin. Now, a facelift procedure has to be individualized, and the type of procedure will depend on the exact age and the condition of the facial skin of the individual. Facelift treats loose, saggy skin, but it treats it usually from a deeper level so that the facelift can last longer. So, a person who desires to have a facelift, is in good health, and is of the appropriate age is a good candidate for facelift procedures. What kind of scars will I have, and will I have permanent scars? The short answer is this: everyone who gets a scar in their, once we are born, anyone who gets a scar will have a permanent scar. However, the placement of the scar is such that the scars become barely visible with time, and unless you're looking for them, you won't see them, even without makeup. So the way I place the incision most often is right from here down to the tragus and then the back of the ear. That incision is virtually invisible with time for most people. Some people may need some help with their scarring, but generally these scars fade really well, and with time they become almost invisible. It's easier for ladies, but even with men, it is so well camouflaged with the lines of the ear and the face that no one would know that you had a procedure done unless you tell them, and they look for it very carefully. Now, the next question is, how long does a facelift last? On an average, facelifts, the deep level facelifts last for about 10 years. If you get it done when you're older, in your 70s, then they may last a little bit less. If you get them done earlier, then they may last a little bit longer. It also depends on the quality of your skin and the elasticity of your skin. Next question is there a way of knowing how I would look after a facelift procedure? There are a bunch of softwares that are available, and the two that we use very commonly is a Canfield camera system, which gives us a 3D view, and then we can modify the pictures to show what you would look like after the procedure, which is just a kind of a estimate. It's not done physically. It's just done on the picture. But because we have done so many of them, we can approximate what you're going to look like after the procedure is done. There is another method that we often use. It's called Chrysalis 3D system, where three pictures are taken and they are stitched together and morphed, and you can move it around and change the various aspects to give you a very good indication of what you're likely to look like after the procedure is done. So in my practice, 3D pictures for facelifts and rhinoplasties and other procedures are very important, both for me to turn things around, move things around, and get an idea as to what I would like to do, and do some measurements as to how much needs to be removed, changed, or lifted, as well as to morph them a little bit and show the potential patient as to what they can expect. The folds below my nose, that is the nasolabial folds, are still present. Will they still be present after a facelift? Is that normal if they still exist there? Most facelifts are not able to address these nasolabial folds. Sometimes people would put fillers here. Sometimes there are specific kinds of facelifts and suturing that can be done that would lift up the nasolabial folds as well, like this. But the average facelift will not specifically address the nasolabial folds. Although when people look in the mirror and see what facelifts are going to look like, they go like this. And the nasolabial fold is almost obliterated, it disappears. But when you're actually doing it, because of the way the connections of the skin with the deeper tissues are, the fold does not disappear with the regular facelift, nor does it become less. Again, there are methods we can use to make it less and almost disappear, but not the regular facelift. The usual incisions, the usual procedure will not change it much. Even when we do procedures to address the nasolabial fold, they should not be overdone, otherwise it looks very artificial. Just imagine looking like this even when smiling. So it's best to have them become softer and not gone completely. What are the different types of facelift? Different kinds of facelifts can mean what are the different kinds of incision, the extent of the incision, the extent of the procedure, or actually the depth of where you would go to do the facelift. So let us first start with the procedure, with the kind of extent of the procedure. The smallest facelift I do is with a very small cut here. We lift this up right here, and that is a mini facelift. Single incision, we lift up the deep tissues and lift it up. It gives fairly good results, especially in people who are in the third or fourth decade of their lives who really need this little lift here. Sometimes I do what is called a mid lift from this incision just next to the eye and in the lower eyelid, and it lifts up the mid face like this. The next would be a limited incision facelift, which goes down to the ear here and ends up right at this ear, does not go towards the back, and is limited on the front also. It goes from literally from here till here. So those are the extent of the incisions. Now the more extensive incisions will include the neck lift, where you lift the neck, small cut here, and the entire incision goes all the way back to lift up the neck and the face completely. For the forehead and brow, other incisions are used, but we'll confine our discussion to the regular facelift incisions. So you have mini facelift, mid facelift, limited incision facelift. Some people have other names for it. Then there is the regular long incision facelift. Next thing to consider is the depth that the facelift is done. The first would be just skin incision only. Just skin is removed and lifted up. The second would be SMAS lift, which is the submuscular epineuritic system, which is actually the little bit of a tissue that covers the muscles of the face. That is lifted up. Sometimes some part of it is cut, lifted, and plicated, and repaired. So that lifts the face at a deeper level and gives longer lasting results. The third is subperiosteal facelift, where the dissection is done at the level of the coverage of the bone. That does give longer lasting results, but does have some limitations itself, and it is done for specific situations, not for the entire face. For most of the surgeons, and for most of the patients, subperiosteal facelift is limited to certain indications and certain patients and certain regions. Now, sometimes people put some meshes or other foreign material in the face to make the facelift last longer and camouflage the depressions and the different contours of the face. Sometimes some fat is added, and autologous fat grafting is very commonly done by me when I do facelift procedures, especially in the regions of hollowing. So those are the different kinds of facelifts that are commonly practiced. Next question is, will I still look like myself once the facelift is done? And the answer is this: most people look like fresher, younger versions of themselves. They don't look like different people. Younger, because that's the aim of the procedure. Fresher, and you want to have that fresher look, but you also want to look a little happy. When the lips are drooping down, people start looking a little sad, like this. So when you lift it up, people look happier, more at peace, younger, and fresher. But they look like themselves. You'll have to change a lot more to make people look like someone else, or look like a completely different version of themselves. All right, so the next question is, can non-surgical procedures offer the same result as a surgical facelift? Now, the short answer is no. They have different indications and different extent to which they can improve things. And some of them can do a really good job with specific indications and specific kinds of problems. However, a surgical facelift cannot be replicated by non-surgical means. We can improve the skin, and there are a bunch of ways of doing it. I often do it with invasive radiofrequency, as in ThermiTite or FaceTite. And sometimes I do it with autologous fat from the person's own body, taken with a little needle, along with some PRP, the platelet-rich plasma, some antioxidants, and those improve those fill the face and improve the quality of the skin. When the face is initially aging, the hollows are more obvious, and those can all be improved by these means. With the invasive radiofrequency, you can get some tightening of the skin, and the results are, with some of them, can last for a fairly long period of time. The other thing that are often done are fillers, which are over the counter. You take these hyaluronic acid fillers and fill up different areas of the body of the face that need to be done. And sometimes people put threads which don't last too long, but they can lift some specific areas from the depth. They don't take care of the loose skin, but when they lift from the depth, things can improve and give a more youthful look. The downtime is much less for any of these procedures, but as far as the threads go, they don't last too long. So if one is going to have a thread lift done, one should be prepared for the results to last maybe a year, maybe a little bit more or a little bit less. The fillers can last up to 2 years. The invasive radiofrequency treatments can last up to 5 years. Again, the improvements should not be compared to surgery because they are not ever exactly the same, but some aspects can be improved a lot by non-surgical means. Can a neck lift be done at the same time as a facelift? And the answer is absolutely, and done very frequently. Now, there are 2 or 3 aspects of neck lift that I want to address here. The first is the platysmal bands. If you see some older people, you will see some neck bands coming here, and you will obviously have some loose skin. Now, with the neck lift, which is done from the back of the ear, sometimes these bands are divided and kind of repair the platysma muscle, which is called a platysmoplasty. So you'll have a nice kind of a hammock here where things are straight and you don't see those strands coming down. Neck lift with platysmoplasty, the excess skin is removed from the back of the ear. It's all lifted up here, removed from the back of the ear to give you a nice jawline and a smoother looking neck. This may be actually a little more difficult part of the facelift when you combine it with the neck lift. But in terms of results, it's extremely important to address the neck when doing a facelift. Otherwise, you'll see actually a lot of you must have seen people on television or on the screen who have youthful, young-looking faces but a very old-looking neck, and that doesn't look too good. So those are the questions I have frequently encountered. People have frequently asked me about facelifts, but there may be other questions that you may have, and you should feel free to contact us through the numbers that are given here or through our email. Thank you, and let us know if we can be of any help for you.